Hello, and welcome to our Module 2 assignment on increased risk of septic shock in patients with diabetes and alcoholism by Rupinder Kaur, Luke Dietz, Erica Fletcher, and Erica Marzanotto. Sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. There are various health states and chronic diseases that worsen the body's ability to compensate for septic shock, with alcoholism and diabetes being amongst them. Diabetes is a disease that causes abnormally high levels of blood glucose due to the body being unable to produce insulin or properly use insulin to lower blood glucose levels. Chronically high blood glucose levels impair white blood cell function, cause polymorphonuclear neutrophil cell migration, and increased cytokine production. Since neutrophils are crucial components of the innate immune response during sepsis, alterations in their function contribute to the progression of sepsis in diabetic patients. The recruitment of neutrophils to a site of inflammation is increased in diabetic patients suffering from infection and/or sepsis. Adhesion is due to an increase in the expression of integrins by neutrophils and adhesion molecules by the endothelium. This causes neutrophils to stimulate the expression of endothelial cells, contributing to the abnormalities of the host's immune response. Next, impaired chemotaxis affects the ability of neutrophils to detect and move towards a chemical inflammatory stimulus, increasing the risk of infection in patients with diabetes. Furthermore, the impairment in white blood cells results in uncontrolled microbial growth, increased numbers of bacteria in the peritoneal fluid and blood, and increased risk of morbidity and mortality from sepsis. The high levels of circulating cytokines in septic patients may further mediate the impairment of neutrophil migration, causing increased complications including coagulation disorders, cardiovascular collapse, and multiple organ failure. In this next section, we will examine the impact of diabetes and sepsis within the context of the oxygen demand and supply framework. Before looking at the impact of diabetes on sepsis, it will be helpful to examine the variables involved with end organ perfusion. End organ perfusion is a term used to describe the effectiveness of the body to supply enough oxygen to meet the demands of vital organs, including the brain, heart, lungs, gut, liver, and kidneys, which is all part of the supply and demand balance. During the state of septic shock, the body has a higher demand for oxygen and must increase its oxygen supply to maintain adequate tissue perfusion. This higher demand is caused by mass vasodilation, decreased circulating volume from leaky blood vessels, as well as increased body temperature from the inflammatory response. Diabetes further exacerbates this issue by causing decreased neutrophil migration within the body. This impairment of neutrophils causes an immunosuppression effect, which will increase the systemic inflammatory response, leading to an increase in temperature. This causes an increase in the body's metabolic need and total oxygen demand needed to compensate. The immunosuppression due to diabetes may cause patients to have prolonged infection times, leading to decompensation. Decompensation ultimately leads to vital organs being starved of oxygen, and failure will occur. If the body is not able to appropriately counteract the increased need for oxygen demand, end organ perfusion worsens, and the chances of multi-organ failure and mortality are increased. Patients experiencing alcoholism also have an increased risk of developing septic shock due to an altered immune response from elevated cortisol and anti-inflammatory cytokine levels. Studies have shown that chronic alcoholism causes hypothalamic pituitary adrenal axis hyperactivity, leading to an increased stress response and higher cortisol levels. Cortisol is usually a beneficial aspect of the immune response with its anti-inflammatory effects, yet chronic elevations can lead to an accumulation of stress hormones and an increased production of cytokines. Within a normal range, cytokines induce signal pathways within the immune system, regulate immune responses, and contribute to other cellular functions. At a beneficial level, cytokines can help eliminate infection, while chronically high levels are associated with an increased risk of tissue and organ damage. With alcoholism, there is a decreased ratio of pro-inflammatory to anti-inflammatory cytokines. Since inflammation is a necessary immune response to pathogens, a higher level of anti-inflammatory cytokines and cortisol synergistically affect an individual's ability to fight infection. This imbalance subsequently increases the risk of developing a life-threatening cascade of sepsis, septic shock, multi-organ failure, and death in patients experiencing alcoholism. In this next section, we will examine the impact of chronic alcoholism and sepsis within the context of the oxygen demand and supply framework. Oxygen demand is affected by temperature, emotional stressors, and activity. Consumption of alcohol can cause reductions in body temperature and diminishes the body's ability to maintain thermostability, thus potentially reducing cellular oxygen demand. Conversely, emotional stressors and activity levels can often increase with alcohol consumption due to changes in impulse control, thus possibly increasing cellular oxygen demand. Oxygen supply is affected by arterial oxygen and cardiac output. Myocardial tissue analysis in patients with chronic alcoholism has been found to resemble idiopathic cardiomyopathy or chronic myocarditis. This can lead to decreased stroke volume, cardiac output, and consequently a reduced oxygen supply. Chronic alcohol users frequently have defective red blood cells that are destroyed prematurely, often resulting in anemia, which could negatively affect oxygen supply. Alcohol may also reduce the affinity of hemoglobin for oxygen, causing greater levels of oxygen desaturation. Connecting the dots. In a healthy human, the body is in a state of flux, constantly compensating to mitigate ongoing changes in oxygen demand and supply. However, during septic shock, multiple organ dysfunction is occurring, causing altered mental status, tachypnea, poor capillary refill, hypotension, tachycardia, thrombocytopenia, metabolic acidosis, and reduced urinary output. Diabetes and chronic alcohol use can impact oxygen supply and demand, and when the system is placed into states such as sepsis, this can further reduce the body's ability to compensate, often leading to increased rates of morbidity and mortality. Thank you for watching our presentation on the increased risk of septic shock and the effects of O2 demand and supply in patients experiencing diabetes and alcoholism.